Hello, I'm Selma Schimmel and welcome to the Group Room. Today I'm joined by Dr. Jonathan Goldman, a medical oncologist and lung specialist at Premiere Oncology in Santa Monica, California, who is here to discuss advances in science that are changing what we know about cancer. We introduced personalized medicine and biomarkers in our last segment. As you learned, personalized medicine uses information about a tumor or a person's genes and proteins to prevent, diagnose, and treat disease. In this segment, we will discuss how a patient can learn more about how they can potentially benefit from biomarkers through biomarker testing. Welcome back, Dr. Goldman.
Thanks, Selma.
Let's talk about what are the benefits of identifying biomarkers and biomarker testing.
The goal is to be able to identify for a patient whether they have a cancer, how their cancer is expected to do on treatment, to get them to the ideal treatment as soon as possible and minimize side effects along the way. So really these are very important advances as science and medicine move forward. We've learned that some cancers can be detected earlier by looking for proteins in the blood. We've learned that tumors can be subgrouped or better understood by looking at their genes or the proteins on the cell surface. And we've also learned that as we treat patients, we can follow some of these biomarkers to better understand how they're doing.
Who should consider being tested?
There are some types of cancer where we know more about biomarkers than others. But I think it's a very appropriate question for anyone to ask their doctor because these are changing all the time. There are specific and significant advances in breast cancer, lung cancer, colon cancer, gastric cancer, and even some rare cancers like gastrointestinal stromal tumor, some lymphomas, some leukemias. So it's really growing and will probably affect all areas of cancer care in the future. Because
you have been part of the evolution of personalized medicine and the identification of biomarkers, what is it like as a physician and sort of the energy when you're able to look at a patient and discuss the fact that they have this option of being tested?
Whenever someone gets a diagnosis of cancer, it is a difficult moment, and they do quickly try to understand what comes next. But by being able to tell a patient about the exciting advances in our understanding and our treatment, I hope to convey hope. They're not going to be treated just like everyone else, that we're going to identify what we think will be the most important approach to their treatment. We'll be able to follow them closely, and also that science is moving so quickly that new treatments may be available soon.
Is there an optimal time when a patient should test for biomarkers?
There are different possibilities for a patient. If a patient is presenting with metastatic or stage 4 disease, then that is a good time to test for these biomarkers. If it's an earlier stage disease, there are some cases where we do and some cases where we may not. But it is, as I said, always an important discussion to have with the doctor or surgeon what tumor testing and what other blood testing might be helpful.
Are there challenges involving the testing process?
There can be. Each test has its different characteristics. Some are from blood, some are from the tumor. Sometimes a biopsy can have some risks that may be more or less significant. There are many times where the information we're getting from the biomarker is so helpful that it is worth undergoing the biopsy, but each case does have to be discussed with the doctor. There are times that we would consider repeat biopsies, for example, and each of those has to be considered carefully.
If a patient has not already been tested or testing has not been discussed, what would be the best way for a patient to maybe begin this biomarker discussion with their doctor? It can be very intimidating for patients to have to raise questions to their own physicians.
The doctor should understand that patients want to understand their specific situation as best as possible. And having a discussion of what do we know about my tumor And are there any advances in scientific understanding of this cancer? I think is a very important discussion to have with your doctor.
These tests are available not just at major centers, but within the private practice?
That is right. Sometimes from a reference lab, not necessarily from a local laboratory, but all of those are commercially available. As we discussed, science is moving so quickly that there are new tests being evaluated, and those may not be widely available, but they are entering that realm quickly.
Dr. Goldman, while we've touched on it, would you please just recap it in talking about really what's involved, the pathology, the process? What can a patient expect out of the testing, the whole procedure that's involved?
It is, in many cases, part of the pathology review of a tumor. As we mentioned, some biomarkers are in blood, but for now let's focus on the ones that are part of tumor testing. So either from a surgery or from a biopsy, the pathologist has a specimen of the tumor. They slice it and make slides to look at it under the microscope, but they can also use these cells to look at the genes of the tumor or to look at the protein, either the expression of protein or how the proteins are on the surface of the cell. By doing either stains, what we call stains of the tumor, or doing genetic testing, we learn about some details of the tumor, and this comes out as part of the pathology report. It can be as soon as 1 to 2 days, or sometimes can take a few weeks. But eventually it will become part of the report and will be given to your doctor to help him or her make your treatment decisions.
If a patient had not been tested at the time of diagnosis, but then decides later on that they will be tested, their existing pathology will support testing at a later date?
In most cases. There are a rare few of these biomarkers that do require identification of wanting to do the test up front, but nearly all of them can be done on the old specimen, as long as there's still specimen left. There are times, now that we're doing so many tests on these tumors, that we may need to do a new biopsy to get more specimen, but in many cases we can test what we already have.
Thank you, Dr. Goldman.
Thank you. It was a pleasure.
Cancer patients, family and friends, you can visit canceritspersonal.com, thegrouproom.tv, and vitaloptions.org for more information. Please look for the next Group Room episode where we're going to discuss the future of personalized medicine and the research behind biomarkers.